Welcome to Indian Union News. Our guest today is founder, president, and CEO of Nirvana Health. We are going to talk to him about what his company does and also about his journey. On November 15th, he will be honored with a Business and Entrepreneurship Award of the Year at the Newland Choice Awards Gala at Burlington Marriott Hotel. Ravi, welcome to our show. And what a beautiful office you have here, and it's great to be here.
Thank you.
So, Ravi, let us first start with your company deals with healthcare industry, which is $4.5 trillion annually in the United States. And I have talked to you many times in the past, and this always has come, and you have always mentioned that there's a lot of waste in this healthcare industry. Roughly about $900 billion, almost $1 trillion a year money wasted. And your challenge and Nirvana Health challenge is to cut that waste. So first tell us about what is the healthcare 4.5 trillion industry, and then where is the waste and where you are trying to cut it down.
Sure. Just to give you a little bit of background, we spend about $4.5 trillion on healthcare. If you go and look at in the overall GDP of every country, there are only two countries have GDP more than $4.5 trillion, right? So we spend out of that $4.5 trillion, there's about $1 trillion wastage is there.
And those two countries are USA, of course.
US and China. Right? And, if you put it in context, India is about $3.7, $3.6 trillion. Right? Under $1 trillion GDP, there are about 150 countries are under $1 trillion GDP.
So how you have been trying to cut that waste?
Right. So what we do is, if you look at, we cover 330 million population, and it costs about $4.5 trillion in US. And basically, if you zoom out, you look at who has that ability to control those wastage. There are two industries. Payer, insurance companies, PBMs, pharmacy benefit managers. They pretty much manage overall, how the care needs to be delivered, measured, and paid for. So these two industries pretty much control these $4.5 trillion, right? So unfortunately, these two industries are very antiquated. And they don't have right platforms and right risk strategies that can platforms support those risk strategies. So what we do at Nirvana Health is we build those platforms to manage these costs effectively, and also value-based care is one which is propagating into the healthcare system very rapidly. So you need to, for a value-based care to succeed, you need to have right platforms. That's what we built it here.
So now for the common people like me who are not really familiar how the money is wasted, how it is used and paid, we think that, the most of the wastage happens in the hospital, so doctors overcharge or pharmacies overcharge. That is the general conception. Right. So this is a false conception. This is
to certain extent, you could be, there are in that ballpark. But to put it in a more accurate way, if you want to bucket the $1 trillion wastage, basically it's $200 billion are avoidable, unnecessary administrative cost, and another $800 billion of avoidable medical costs. These avoidable medical costs are due to fraud, waste, and abuse.
So what are some of the platforms your technology Nirvana Health has? So just tell us about your products.
Right. So we built platforms to manage these two industries. And if I put it again in simple words, when every dollar of this $4.5 trillion comes to some kind of payer, some kind of insurance company or federal government or state government, right? And they get into, once that comes into the these entities, basically gets into three buckets: administrative costs, medical costs, that means total cost of care bucket, and profits. So health insurance companies can keep about 15% of the premium, and 85% has to go outside the door. That is carried to all the care delivery facilities. We call that as a total medical loss ratio, right? And whatever leftover in this 15%, whatever leftover points becomes the profit for the insurance company. So insurance companies normally run in that 15 points. They run at 11 to 12 points at the cost. So if you really have right appropriate system, you could drop that to, instead of 11 to 12 points, you could drop it to 6 to 7 points.
So if I'm a health insurance company and I come to you and say, look, I have all this big mess and our system is 50-year-old, and I have heard about Nirvana, they do a great job. So how will you sell your product to me? Tell me how you will cut my cost and waste.
Typically what we do is we do some kind of financial models, and if it is a public company, you have all that information available on the web. So you go and do the financial analysis, where their admin costs are, where their medical costs are. Obviously within that medical cost bucket, there are several areas. We look at it and we come back and we model it, and we come back and say that, okay, in this administrative cost bucket, your costs are 11, 12 points out of the 15 points. You could bring it to 7 to 8 points, right? And how do we do it? Through the platform efficiencies. And this is obviously very laborious process. These diligence processes last for week to 10 days, on and off. And some of these diligence last for 2 years before they select a vendor like us, right? And then when you look at that financially, the 85% of the cost, which is spending on the total cost of care, and you really have, if you have right platforms and right risk strategies, you can manage that 85 points at 75 points for the total cost of care. So that's what we specialize in: reducing the admin costs and reducing the overall medical costs, improving the overall quality of life of the patients.
So Ravi, one of your platforms is Arya, and tell us about that platform.
We named Arya. Arya has two platforms basically: Arya Payer Platform and Arya PBM Platform. Arya Payer Platform optimizes entire administrative and care continuum for insurance companies. Arya PBM Platform optimizes the entire PBM operations so that you could effectively run the PBMs with a lower admin dollars.
Now, earlier you said that most of these companies have their system 40, 50-year-old. And also in last 40, 50 years, there has been a lot of changes in the government healthcare policies, and always something keeps happening there. So how that compliance part comes into play in the waste or in taking care of the health and compliance?
So see, if you look at these insurance industries in the past, they had that elasticity. As the costs are going up, they kept raising the premiums, right? But in the recent past, there's a enormous pressure on all these insurance companies, because CMS started cutting the reimbursements on the Medicare population. Whenever Medicare is the first one, cuts the payments, and then it follows. Medicaid follows. Then after that, commercial insurers, employers, and all look for the savings. If you look at what is happening in the industry currently, there will be about 10 to 15% cuts in the Medicare reimbursements to the health plans, right? So basically, they have to go back and find that 10 to 15% of savings in this 15% and 85%. So they go back, first thing they go back and restructure the contract with all the care delivery facilities, providers, hospitals, labs, pharmacies, all those care delivery facilities. And so they drop the prices until the providers, hospitals say we don't want to deal with the Medicaid population, right? That's where they will stop it, insurance company. Now they come back at the same time, they come back and look at their admin bucket and see where else they can cut. So in the past, that there was luxury for them, and there was no more luxury. All these national carriers and local plans, they are heavily looking at how to modernize their infrastructure so that they can reduce their admin costs and overall medical costs, improve the quality of life.
So, have you ever been contacted by the U.S. government or the Senate or House of Representatives to come and talk to you about the cost cutting?
We went to various legislators and we went in the past. But again, obviously CMS, Center for Medicare and Medicaid, is the largest payer in the country. They manage about 1.6 or 1.7 trillion dollars, and obviously they also run on very antiquated platforms. And there is an opportunity for them to cut it by 15-20% if they really use the right platforms and right risk strategies. That means, again, if you look at that 60 million Medicare population, and about 40% is in the managed Medicare. That means they give the risk to the insurance companies. They manage the risk, like Pooja's company, right? She's in Medicare Advantage health plan. She takes a risk from the government and manages the risk effectively. And there is another 60% of Medicare population is still in the fee-for-service. That fee-for-service means basically CMS takes the risk, and they can pretty much go to any provider, and that bucket is not well managed. CMS would love to push that to the insurers so that insurers can take and insurers can effectively manage it. So at that time, again, more and more demand is there from the insurers to modernize their infrastructure so that they can reduce the cost and effectively run the health plan.
So Ravi, you have a background. You started studying environmental engineering.
Mm-hmm.
And what made you to get into the healthcare technology? Yes.
So basically, I used to work at Harvard School of Public Health, and I started an environmental research firm in the beginning. And then my brother Krishna came and joined me. That's when we got into the software consulting, and we made a lot of money. And then we left that. We wanted to get into the product vertical, and I chose healthcare vertical, and Krishna chose government sector. And we started building the platforms. And initially, we got introduced by so friends of us who are working in insurance companies, and we studied the landscape. And we found an enormous opportunity in the health plans world, health insurance companies world. And we started understanding where the money is coming from, how it's being spent, and how can we optimize. We basically followed the dollar, where the dollars are coming, how they're spent across the administrative and care continuum, and how can we reduce these two buckets. That's what we did. It's a lot of more like a common sense.
Perfect. And I think so now, talking about common sense, if you can talk about maybe 3 or 4 key ingredients for success in business and entrepreneurship.
Whatever I know, I'll tell you.
Sure.
But basically persistence, hard work, and you have to have a good team. So company is nothing but your success depends on your team. So you want to hire, much modern and much more hardworking people than you. Obviously, for any business to succeed, you have to understand your space, and you have to understand your competition. You have to understand how the business is being currently done. And if you want to transform existing 50, 70-year-old industry, you have to have ultimate conviction, determination, right? And it's not one-man job. It's a team of people. So I'm always fortunate to have right talented people, and that's my strength, attracting right talented people. And basically, once you have the right team, and you not only you, the team has same conviction to build something revolutionary, and take it to the very conservative industry and deploy it, scale it, and make the customers happy. And that takes about 5 to 7 year journey, right? And throughout this period, you have to have that conviction, persistence, and determination.
Now, since I'm here in your office, and what a beautiful office you have. It's, you can just spend a whole day and night here working, and get a great view. So, when did you move in this building?
Moved about 4 years ago.
4 years ago. And who was responsible for designing and all these things? How that came?
A couple of myself, couple of people. We didn't do much other than we took this office space, a lot of small offices. We said open it up and then put the glass from floor to ceiling, and then make it very bright. No offices. We have all collaborative spaces, and we have over 20 conference rooms, which are nothing but glass cubes. So even my office is nothing but a large conference room. And the goal is we want to keep no barriers. So basically, if all the space is collaborative, so anybody can walk to anybody and brainstorm and share their ideas. So that's how we built this whole,
It's a beautiful office. These days, a lot of people work from home. How many people come to work here in your office?
We have full capacity. Unless we hired originally out of Massachusetts, outside of Massachusetts, we gave them option to work from remotely. But who were living in Massachusetts, they have to come full time. That's what we make it.
And they have come to the office.
All of them come to the office.
Okay. So now let us have some fun. Who is Ravi Ika? Where was he born? Tell us a little bit about where you grew up and you're growing up.
We all came from India, from Andhra. My father used to work for electricity board. So we were all over Andhra and finally settled in Hyderabad. We four brothers. We studied there. Today, all four of us live in Southborough, and my mom can walk to two of my brothers, and third one is about a mile apart.
They have their different businesses, or you are the only one with
Everybody they have their own different businesses. But we are shareholders in all those companies.
All those companies, okay. And which year did you come to US and where did you go from?
1986.
1986. And then when did you come to Boston?
I went to school in Virginia, did my master's there, and then I moved here in 89. Then I started working at Harvard School of Public Health.
So, Ravi, you were talking about the insurance companies, and we at Indian News, we had done several articles about Pooja Ika. She's your daughter, and she also started an insurance company dealing with Medicare, etc. And is she your customer?
She's our customer, first Medicare customer, a tough customer though. And basically, when she was growing up, when I was building Ika Systems and RxAdvance, she was growing up. All my investors are either built the health insurance companies or health systems, or taking the risk from the insurance companies like IPAs or ACOs. And she started, she listened enough while she's going through school, college, and then just before graduating from Babson, and she said, "Dad, I have decided to start a Medicare Advantage plan. I heard of so much. Obviously, we discussed this several times, and I've decided to start the Medicare Advantage from scratch. And so I will embrace your platform. I know that you've been trying to sell to all these insurance companies. They take bits and pieces, but I'll embrace the platform entirely, and then show what is possible, really possible." That's what she's doing right now. She's in Mass and Arizona, and she has plans to expand in other states and also acquire smaller plans so that she can consolidate all these lives and run on our platform, show what is really possible to the national carriers.
And she's also on Fast Track herself, and she was in a number of lists across
So she's in the she's running, and obviously this is a very tough business and very regulated, very tough. And then, but however, this is the fulcrum of healthcare. Owning a health plan means you own the premium. So you got to know how to manage that premium very effectively. You have a couple of points here, couple of points here. You've got to be very careful to manage the risk of dealing with the care delivery facilities, contracting. There's a lot of moving parts here. So, but the rewards are there.
So now, since we talked about Pooja Ika, your daughter, I have to ask you about your wife. She's a physician, and has she given you any feedback about, from the health practitioner point of view, or not really? She's not involved into this.
She's not at all involved. Now and then she wants to share her opinion. She's an internist, works at UMass, and she has her own opinion. But she wants to, she doesn't get involved, neither in my business nor Pooja's business. She's a silent observer.
Now, how did you meet her? Where did you do an arranged marriage, or did you met her?
It was an arranged marriage. After getting my green card, I went to India, and that was in 1989. Parents identified about half a dozen, girls across the country. My wife happened to be in Bombay, so I went and saw her. She was the first girl.
Now, I also want to talk to you about the mentorship. That if I ask you, who are some of the people who have really inspired you in business as well as in personal journey or personal life? Is there anyone who have been really think, oh my God, what a great job this person did?
Some people like in our community, a lot of people heard of. Subbu is one of those early people who started the business across.
Subbu Kota,
right?
Sure.
And he was inspiration for a lot of people. And coming back to actually professionally, and Steve Wiggins, who founded Oxford Health. And Dr. Kiran Patel, who started WellCare, and George Rapier, who built WellMed, which is the largest IPA in the country and owned by United Healthcare. And some of those people really, I admire them. They are my mentors, and that's where I, got the inspiration.
How old is nirvanaHealth?
It's a 10-year-old company.
10-year-old company. Okay, and it's all it's a venture funded or self-funded or combination.
We have not taken in venture capital or private equity. It's all self-funded. We took capital from high net worth individuals who's built high-tech companies like John Scully. Or people who built really health.
John Scully, the former CEO of Apple.
And individuals who built health insurance companies like Dr. Kiran Patel, Steve Wiggins, George Rapier, or health systems, or they own the risk entities like IPAs, ACOs. Those are the people we basically took the capital from, and we are at that juncture. We are going to align very quickly, very soon, with another national entity, and to take it to the next level.
So, Ravi, what you are envisioning for Nirvana in the future?
I don't think we want to go in an IPO route. This is very the company is well primed for strategics, a national carrier, insurance carrier, or companies like Amazon. Amazon is our customer. Half of the Amazon employees on our platform, and Amazon has strong ambitions to get into healthcare big time. And some companies like Amazon and some of these credit card companies like Visa, MasterCard, they all want to get into healthcare space. So we believe we have right assets for them to make our company as a foundation to go after big time into this healthcare industry.
So Nirvana could be a prime target for any one of those.
Could be.
Okay, excellent. Ravi, thank you so much.
Pleasure.